Buenas tardes, good afternoon. Bienvenidos a ¿Qué pasa mujer? Welcome to ¿Qué pasa mujer? Estamos aquí todos los domingos a las 4 de la tarde. So we're here every Sunday at 4 o'clock Eastern Standard Time. Estamos celebrando otro domingo. So we're here again every Sunday. Happy Easter to everybody who celebrates it. Hoy tenemos una invitada muy especial. Vamos a hablar en inglés porque ella no habla español, pero vamos a tener un tema muy importante que es la dependencia de sustancias legales. So today we have a very special guest. We're going to bring her on shortly. But first, we wanted to touch bases, as we talk about every week, are setting our goals, fulfilling our goals, touching bases with our goals, perhaps having someone that can be our accountability partner in reference to where we are with the goals. So we just want to touch bases about that. We're in April. We're celebrating Easter today. Most families are, but it's a good time to start preparing for the summertime and the decisions that we're making. So all of those things. So we're going to go ahead and get started because it's a very hot, diverse topic that we're going to discuss today. And so we'll go ahead and have Mark, our producer, because if it wasn't for him, we couldn't, you couldn't see me, you couldn't hear me. But we're going to go ahead and bring Ms. Green on, Mark, so we could go ahead and get started with our topic. This is Noelle Green from NSG Living. Welcome to our show. Welcome to ¿Qué pasa mujer?
Thank you. I'm happy to be here.
Yes. So we're going to talk about a little bit of everything, but I wanted you to maybe tell us a little bit about addiction and how does that work in the world that you live in?
Okay. My name is, again, Noelle. I'm a nurse practitioner for about 20 years of nursing experience. About 10 of it was in addiction medicine. So that's part of my enjoyment is mental health as a primary care provider and bringing understanding, life support, skill support to clients that may suffer from an array of mental health disorders such as addiction, ADHD, of those assortments.
How I know you and I kind of talked about this offline a little bit before the other ladies join us, but we talked about when we start to date, right? When we're dating people as single people and we date, we kind of talked about a little bit of certain things to look for, right? When it comes to addiction, because I think especially as we get older and we're dating or we're in that arena, we how there's a lot of TikTok videos about the red flags and all, like all that good stuff. What are some things that you think that we need to look for men and women when it comes to having either an addictive personality or because it doesn't mean that we won't be able to date them. It's just so that at least so that we have knowledge that it exists. Something simple could be like, biting of the nails, and that's anxiety, or, things like that can affect the relationship.
Well, addiction is, how can I say it? Addiction is not the person. So we never want to label somebody that has an addiction issue as that's only them. But when dating, it could be very tricky because there's a lot of things that does come with addiction. Masking, maybe not being upfront about their addiction and what they do and their drug of choice. So part of understanding that would be with dating is being very aware of not red flag. Well, I guess we can call it red flags in this culture, but red flags would be avoidance or overindulging while on a date. So if they have an alcohol problem, you may see them drinking abundantly. This may be a cue to you to maybe ask more questions or talk about drinking, or if they have been transparent and honest and open and having these non-judgmental conversations about, hey, do you have a history of addiction? Or even disclosing it in your family. Hey, I have a history of addiction in my family. Do you share that do we have that in common, or are you struggling with addiction? So I mean, there's other things, there's certain things. If they're alcoholics, you're not going to maybe sort of say have that appeal or those red flags in the beginning. But maybe if they're IV users, you will see track marks or irritability if that date goes on longer than they would like.
That's very interesting. So our producer wants to know: do people switch from addiction to another addiction, whether it's alcohol to food? Because I know sometimes they've said, well, things that I've read in a book is, to get rid of an addiction, you kind of have to replace it with something else. So
So,
what do you
yeah,
think?
so sometimes, well, I think that there's different types of people in the world, and we have to consider that. Addiction, you can have an addiction type of personality that will make you more acceptable to having addiction to medications or addictions to drugs or addiction to people. It just shows up differently. And yes, you can switch from one to another and forth and back, or substitute things. So you have people that may have, for instance, given up smoking, but then they'll go and become gym rats, or they'll give up going to the gym and then they become, smokers, or a health fanatic in what they eat. So it does vary, and some of these things aren't negative, and some of these things are positive. So we have to look at it from all kind of angles and different lenses.
Hi, Maddie. Yeah, because I think sometimes, I think it's, for me, my experience, my life experience is, I think it's just being aware that it exists, right? So, like, having knowledge that I've gone through the process to acknowledge whatever addiction it might be, or whatever, I might call it a hobby versus an addiction because it sounds better, right?
Right.
But just kind of knowing self to then be able to have that open conversation with someone about who I am, or if I'm in a space where I'm not willing to accept an addiction or a habit that somebody might have because it's not aligned with me and my lifestyle.
Right, right. But I also find with dating that would be hard to like identify until you probably got into the mix of things, because most people aren't going to be, hey, I have this addictive type of personality. So
Yeah, that's
it's definitely difficult in the dating realm to identify anybody that you're dating if they have addictive behaviors.
true.
Because
So
if it's
this is Maddie, Noel.
Maddie, right? Because you got to think about it.
Yeah, so we
The
were
first.
Maddie. Yeah. No, go ahead.
No, I was just saying you got to think about when you're dating. Everybody's on good behavior for the first 90 days. So things that you may think are addictive or impulsive behaviors probably won't really resonate into that time frame.
Yeah, that's true. I also wanted to ask you, in reference to addiction, because I don't know if you have any statistics for us in reference to young people. I don't know if there's more young people today taking prescription medication more than, let's say, 30 years ago, and maybe those people that are taking medicine at a younger age. Is that something that can potentially, as they get older, they will continue to be addicted to it? Or like, how do young people manage the fact that you have to take medication on a daily basis and not to turn into something else?
So I don't think medication and addiction go hand in hand. So I think it's more or less the diagnoses and what you've been diagnosed with that would go coexist with addiction. So that would be for what's big on. Let's talk about what's big on now. TikTok is everybody being aware of ADHD. So, for instance, you have a lot of parents that are on the fence with starting their kids on medication for ADHD because they have a fear of abuse or them becoming drug addicts, when it's really the non-treatment of ADHD that may lead to that, because now they have feelings of insecurity or self-masking and of that nature. So that's what's important, more important, or what happens is people don't want to take medication because they feel that it may cause an addiction, when in actuality it's actually the diagnosis that will make you more acceptable to addiction than the actual medication and being on medication. If you have a healthy discussion about medication and what it's for and how to use it, especially with children at a young age, it shows that they're most likely not to develop an addiction.
That's interesting. I saw a documentary a couple of years ago. Yeah, I saw a documentary a couple of years ago that talked about young people tapping into their parents' prescription drugs. What what do you think about that?
So even with that,
Often
I
does
think
that
that
happen?
that's the a conversation that has to be had between the child and the parent, because it becomes that a misunderstanding that happens. Or hey, if you're a parent that has pain management that's on Percocet, but you don't lock up your medications, you don't have this conversation how these drugs are dangerous when they're not misused and the benefits of them, then yes, that happens. And being transparent and not looking at it as, oh no, you shouldn't do this, or in a negative form. I think when we start looking at medication and taking it negatively, it also builds a curiosity in children to say, well, what is this? Or we don't give them the empowerment to say, you have the option of saying no when these things are offered to you.
Yeah, and I think it's Maddie always tells us, we have to get educated. So I think
Yes,
it's that piece that sometimes maybe when drugs are being prescribed, they're not having conversations. Uh,
yes.
the practitioners with the patients. And so what do you think as patients, what are some things that we should be asking? Because typically the doctor knows, they have a list of all the medication you're taking just to make sure there's no danger when it comes to that. But what are some things that we could be asking our doctors?
Asking them, are there side effects? Or depending on, like I said, the medications that is being prescribed, are there side effects? Is this medication addictive? How to care for this medication? What side effects do I need to look for? And if it's an addictive medication, or a medication that is misused a lot, having that conversation, and it's going to be in the household with children, having that conversation with your child to say, hey, this is what this medication is capable of doing. And allow them to ask questions. And if you don't have the answers to the questions, that provider, make an appointment to talk to the provider or the nurse about this medication so that they can understand how dangerous it is. But it could be beneficial. So at the end of the day, you don't want to scare anybody about medication or use it a scare tactic, but you want to definitely inform them so that they can be comfortable to say, okay, this is what can happen. This is why we tell you. So explaining to children that yes, it may make you feel good, but what happens is eventually the more and more you use it, you don't feel good and you start feeling bad, and it will make you sick. So explaining it in terms that they can understand will definitely help. And it helps the parent as well, because a lot of us, and I see it all the time in my clients, I could say and go over this medication and they'll be like, what, huh? Or when they get home, be like, I don't even know what that provider said. So it's okay to go back, ask questions. If you see your doctor or your nurse practitioner and you have questions afterwards, after you really were able to digest and process it, write your notes down and call back and say, hey, or now everybody has a my chart of some sorts. Send it into my chart. These are my questions that I didn't get to think about while I was in that visit. Can you please answer them?
Yeah, our producer said Maddie's addicted to poetry, but it's okay.
No,
Well,
I was gonna say that's a healthy one, right? I hope so.
I think
That's a
so.
yes,
healthy one, right?
right. So, and that's the issue. Some things, some addictions are healthy and acceptable, but all in moderation. Too much poetry, you won't get nothing.
True, that is so true. I agree with that one. No, I wanted to jump in and say a little bit about the conversation, the part of the conversation. It's like it's so important. Like Viviana said, I'm big on educate yourself, because if you don't know, you have to know yourself. I
Right.
think we have to become self-aware, and know your extremes, know your buttons, like know yourself first.
Right.
I know that about a year and a half ago, my son tore his labrum, and he had to have surgery to correct it. And I remember the pain medication that he received, like right after surgery, was an opioid.
Right.
And I panicked. I freaked out. I went into freak out mode, and it was. But I wanted to have the conversation in front of the doctor, in front of the nurse. I encouraged my son to ask questions, and I think you have to have those open conversations with children also about family history, because sometimes we think those things are taboo, and we don't want our children to think of it as acceptable. But if you're not open and you say, this is what has happened in our family, we've seen this, we've seen that, so that they are aware, so that they know what decisions to make. And I am so proud to say that my son used his medication. Like, the first week he was very loyal, because we were like, you're going to be in pain, and in order to heal, you have to kind of tame down the pain. He used his medication, and then he wanted to drive, and he wanted to do things, and I was like, well, you can't do any of that while you're on your medication. And he was very good about taking, winning himself off of it slowly, and getting to a point where he was not in pain, or a point that he could handle it. And I was very proud of him for that. But I think if we wouldn't have had those conversations, probably he would have made other decisions. I do have an addictive personality, and I know it, and I recognize it. And I always talk about that with my children. This is my experience. And I want you to be aware, because it can happen to you. So.
Right, right. And in being an addiction, a lot of the clients that I come across to started their addiction either in a car accident, dental procedure, surgery that may have went wrong or got botched. So, and nobody had these conversations with them to say, hey, this is what we're going to do. This is, if you feel that you're becoming addictive, it's okay to call in the office. We can switch you to something different in the time being, to get the pain relief that you need.
That's interesting. Before we move on, I wanted to acknowledge some of our viewers, Lily Matos, Tangi, Nancy Sutachan, Juanita, and I'm sure there's others, but we only know when you're active because you made a comment. So make a comment. You could at least say hola mujeres or hello, but I just wanted to acknowledge the ones that have placed comments so far. I wanted you to talk a little bit. I'm going to need like a one-on-one consultation, because this is something that I've always questioned about myself. I have like a fear of addiction, right?
Right.
Something simple like drinking coffee. If I drink coffee, I drink decaf coffee, because I don't ever, in my mind, I don't ever want to feel addicted to having that urge to have coffee every day. And even with drinking decaf, I would still kind of feel addicted to it. And as soon as I feel the urge to drink that morning, I will not drink it, and I won't drink it for months, because
So
it's that fear. And I've tried to analyze myself, because I didn't grow up around it. Like where is it coming from?
I'm not sure where the fear for you would come in. We would definitely have to have a consult and dig a little bit deeper. But as humans, we love repetition. We love every day to look like the same day, so we can expect that. So whether it's coffee, chocolate, ice cream, poetry, when we get these things every day that get our dopamine up, we're going to be like, yes, this is a good day, and want to continue it. So anything, and like I said, could be an addiction, or that we just love it because it does produce that dopamine, adrenaline that we need, or that we desire and like. So yes, you can switch coffee. You might just like, it could be a warm beverage of any sorts that isn't caffeine, but you like it in the morning. It calms me down. It's familiar. So sometimes I think addiction and familiarity, we can kind of get confused.
Gotcha. That makes sense. So we wanted to ask also about workaholics.
It's their
Why?
comfort zone.
Why?
So again, workaholics, is it an addiction or are we avoiding something? So that's part of digging in that deeper root. Do we go to work because when we get home, we don't want to deal with the kids, we don't want to cook, we don't want to clean? But you know what? It's easy to be around other adults, have big girl conversations, laugh, kiki, and do work versus going home and having to deal with the situations that lie at hand or dating. Hey, I'm lonely, so now I will become a workaholic because it allows me to fulfill myself and feel like I belong to somebody and not deal with the loneliness at home. So again, these are root things that need to be discussed with, whether it's a therapist or psychologist, whatever you feel comfortable with or have access to.
Great. So tell us a little bit about the alternatives, right? And if you could tell us a little bit about the consultations that you do with your business, NSG Living. What is NSG Living? What does it do? Because I think from the little bit that I know about it is just some alternatives so that Viviana can find out why she's a workaholic or why she stops drinking coffee when she starts to feel that urge.
Right. So NSG Living is my overall company that has little sub companies that may help identify what people need. So NSG Wellness is more primary care, mental health, that pairs you up with a provider to provide those kind of services. Then I have NSG Drip Lounge, which allows you to do IV therapy, which can be an alternative therapy with receiving a customized IV drip that will help detox you, hydrate you. Also, we have certain combinations of drips that will help actually soothe the nervous system. So if you're anxious, high strung person, that it will allow you to be more calmer with vitamins and minerals to help calm the nervous system versus some people that don't want to take medications. And then I have NSG Housing, which allows people to kind of like an Airbnb, allows them to relax and get these service in-house to have a good, wellness experience. My real goal is to take the doctor or the white lab coat out of health and turn it into wellness, like a healthy wellness lifestyle.
Tell me a little bit about the drip. Maddie, when we have a drip party, you're invited.
Yeah.
But tell me what that looks like. What we could do with it, because you provide the service, but I'm sure they do it in other states and other countries as well. Because I knew about it because in Colombia they use that a lot. But it was hard to find something here, and when we talked about it, I got extremely excited because tell us why. I love the
So
concept.
again, so IV therapy is using IV fluids such as minerals and vitamins to help supplement your system and make you feel better. The different combinations of substances, minerals, or vitamins will help with whatever you want. So some people want to focus on weight loss. So we have things that help focus on weight loss. Some mental fatigue and stress, pain, nausea, just high vitamin C that helps with immunity, things like of that nature. So that's where the alternative comes to with pampering yourself. Like, hey, let's go. Let's get the girls together. That's where the IV drip lounge comes into place. Let's get the girls together and have this IV happy hour party, because why does it look like you have to do this by yourself? Wellness is part of community, eating, enjoying the companies of your girlfriends and your friends. And that is NSG Living, coming together and having this excitement of, hey, we're going to take care of ourselves, have a good time, and rock out because we deserve it.
It's
Mm-hmm.
it's funny you say that because About 2 years ago, I went on vacation. We take the summer vacations with I call them my husband's kids because he used to be a volleyball coach in college back in the days, and we grew up with these kids playing volleyball, and so we get together once a year and we go on vacation. One of the kids, it's an anesthesiologist, and one of the guys in the group got sick, and
Right.
he's like, I recommend that you do an IV for hydration. And next thing you know, we were all laying in the living room of this house that we had rented so that we all could stay. And everybody had an IV drip on them. And we were taking in fluids and, the tools that were sick, they were, had some medication on it. But the rest of us were like taking in fluids because it was in the middle of the summer. And,
Right.
it was like, I think right after COVID and stuff. So we were like, oh no, and we did it, and I do have to say it did help, but it was fun that we did it as a group, and it
Right.
didn't feel weird, so
Right, right. So just think about what the NSG experience would be, having that with the mock cocktail in your hand that supports the IV drip that's going in your veins, along with little snacks and food. Like, it's like what we're made of. Anything good, conversation, being able to talk and enjoy something that not only, like we were talking about, a warm beverage or even a cool one, a refreshing one. Yeah. And then also knowing that you're enjoying this and it's really helping your health. I think if a lot more people did this, they would see the improvement that they would have in their work life, their home life, and then in their own life, their own well-being. Yeah.
Yeah, because it's part of your self-care.
Yeah.
Is there an age restriction as to how young you can be to do it?
No. From what I've researched, the youngest that they will give it to would be age 14, all the way up to 99. You think you can be 100. When you go to
Right.
the hospital, they get fluids.
Mhm.
It would
Mm-hmm.
just be in moderation according to what their health risks are and their complications. If they have any issues with their kidneys or urinary output, that would be something that we would work around and give, with their consult.
Let me ask you. I know that we keep saying, like it's about conversation and talking to the family, but also, have you seen an increase on maybe older people reaching out for help? Because I know, like with the young ones, we can start them young. We can start having these conversations, and then when you have certain tendencies, it's a little bit easier to address if the window, if the conversation is open. But with the older people, with let's say, with our parents that didn't grow up around therapy, or knowing that these conversations need to be had, that these topics are not taboo, and that you can get help. Have you seen now an increase on older people reaching out for help, and what does that look like?
Help in as far as therapy, or help as, because as they get older, depending on that generation, they don't want help, period. They don't want the therapy help, and they definitely don't want to see the provider. So what I do find out is when they sign up for the concierge service, they like it much better because it's not the white coat. They love that I'll call them and be like, or send them, some of them like text messages. Hey, how you doing? Just to check in, what's going on? And sitting down with them and having them do a health book, my health book, which makes it easier, and having conversations with them. I think that's the part that I find in my business that they love, is the concierge service, because I give them that one-on-one conversation to say, hey, this is what this, or if they have a question with their labs, I will have a conversation. They come in, they sit down, and we'll go through, this is what this means. And it's a slower pace. And that's what they like, I think, which allows them to come in with the older generation.
Yeah. It's it's like I my dad is 77, and he moved in with me a couple of years ago. And of course, he grew up the way he grew up, and he is how he is, and we just you kind of learn to accept things. But
Mhm.
then now it's like, we're having certain conversations that we were not used to having, and it's like, we lost my mom 2 years ago, and
Mhm.
4 years ago we lost my brother, and my dad used to live with both of them.
Right,
So he went, from having, these people living in a house, in a home with him, to not having them at all. And it's like, it's been a couple of years, but he never talked about it. So the
right.
other day I took him to his, primary care physician, and we're doing a consultation. And I asked my dad, I was like, you know, um, not necessarily therapy, but would you be willing to talk to somebody, just, to vent, and, whatever. We moved him from New York, where everybody was accessible, to now in Virginia, where if you don't have a car, you don't get to go out and see
Right.
other people. So he does spend a lot of time alone. And let me tell you, I almost fainted when he said, okay.
Yes, yes.
I was
But
like,
it's the
"Mom,
words.
that's me.
Words
Yes, the
matter. It's the
therapy.
words.
Yes."
Because if you would have been like,
So,
you want to see a
that.
psychologist, he would have been like, nah, I'm not crazy. I don't like using the crazy word, but that would have been like, I'm not crazy. But the fact that on how you word it to him would
Mhm.
made it probably easier for him to open up and be accessible to it. To say, yes, yes, I would love to talk to somebody. I don't want to sit on the couch. Because that to them that's admitting something's wrong. But the fact that
Mhm.
would you like to talk to somebody about this, that is the difference in them receiving the help.
Mhm. Also, our producer is throwing questions in there, but I also wanted to know, because because again, with, again, my own family history, like, again, my dad doesn't drive, he doesn't, so anything that he needs, we would have to get. He is a smoker, so in order for him to get cigarettes, I have to buy the cigarettes, so what do you think about enablers, and when you have people with, with an addiction, it's like, how can we help and not be enablers?
So we have to identify, are we really enabling? So this the difference in scenario would be between your dad being a smoker. He's Are you really an enabler? Because this is something he's been doing his whole life. He's just now declining in care. So, yes, while we don't want him to smoke, well, maybe this might be a time to have a conversation with, hey, dad, I feel uncomfortable with buying you cigarettes. However, maybe we can compromise and, you can actually have this conversation to help him decrease his smoking.
we
Because,
we did we've done that, and I'm so proud of him, because he went
yeah,
from three packs a day to under one pack a day.
right. So now, and also, did we celebrate him? You know what I'm saying? To
I
say, hey, good job, good job. And, in these situations where we're talking about trading one thing for another, is what you're trading it for harming him or enhancing him?
Mhm.
So that's the other thing we need to look at. Do I think you're an enabler? Absolutely not. Your dad raised you, took care of you. What he's done in smoking cigarettes, yes, it's not a good habit, but that doesn't make you an enabler, because in the aspect of you're his caretaker. So we're not sitting there trying to parent them. We just want them to have a greater quality of life. So in my opinion, you are not that's not considered an enabler. Enabler is knowing that there is wrong behavior that has really bad consequences, not only to that person, but to other people.
And what do you say to parents? Like Viviana said earlier, I saw, like, there's a bunch of shows on TV. There's one that's called Intervention, and it's usually, about people that have some kind of addiction, and the family just kind of steps in. In a lot of those shows, you see that the parents, let the children either live in the house, or do drugs in the house, or,
That would
whatever.
be enabling. So,
So
like, allowing your children to partake in drug use, especially underage, that again, that would be that would, in my book, be enabling. if you're saying, okay, my child is addicted to opioids, I'm going to take accountability for that and maybe put them in sports or do these things or buy these things in terms so that they don't use opiates, then that's not enabling. But if I'm allowing that behavior to be present and I'm supporting that behavior and I'm not doing anything to help deter it, that's an enabler.
Mm.
So I think
How?
that's the difference. And I think sometimes it gets confusing,
Mhm.
or more opinion, like depending on what it is considered enabling. It could be enabling that you have children that just won't grow up. And you have parents that are just like, well, I'll cook, clean, take care of them, and do all of these things like they're 3 and they're 33. That's
Mhm.
enabling can look in a lot of different ways.
What I mean, what is some advice that you may have for maybe a parent that may have a child in a situation like that? Again, I look always look back at my family history, and did have a close relative that was going through situation, and parents kept putting him on rehab, and it just didn't help.
Right.
What can I mean, like,
So
what?
addiction, when we're talking about addiction, addiction is very heavy for both the person and the family. So my suggestion with that is embracing it, conversation, being involved, being present, staying away from the negativity of things, but being
Mhm,
direct. Like, it's
mhm,
not okay to steal from me to go buy that. Being able to say those things,
mhm,
however, but not doing it in a way where it breaks down communication with your
mhm,
children during this, or not feeling like they're supported. Hey, I'm here to help you, however, I will not tolerate this type of behavior. And it's going to come back with kickback. It's going to
mhm,
happen. They have an issue with self-regulation. So for parents, it can be hard because now the biggest thing that I see for the parent is the self blame and the
mhm,
guilt. And
mhm,
you have to deal with that and overcome that to actually help them and be able to have healthy boundaries for you and your child in place.
mhm.
Yeah.
Yeah, yeah. I think that that also the self blame, because as
Yeah.
a parent, it's very easy to blame ourselves when we don't know what to do.
Right.
When our children are going through something, and it's like, okay, how did I help that to happen? But again, we have to take care of ourselves too. Sometimes we talk
Yes.
about addiction, and and the people that we love,
Mhm.
and yes, they're suffering, but also we are suffering because we are in there too.
Right. Right.
um
And,
yeah.
and you got to consider the parent with multiple children. How do we do with this? So for example, in my family, my brother had some mental health issues that was explosive, bad behaviors, and they would display this in front of my children. So I would really have to have these conversations with my daughter and my son. Hey, this is what this diagnosis is. This is the behavior. It's not acceptable. We are trying to help him. And while we are every day interacting with him and he's in my home, this doesn't make it acceptable. This is not acceptable. So also being open and transparent with the other
Mhm.
children and the other family members in the house is important too, because they may view it. My younger kids will be like, oh, why are you letting such and such getting away with this, and we can't do it? And then it
Mhm.
becomes a thing of between your children thinking you love them more than that, or
Mhm.
favoritism. And it's not the case. It's just that they don't understand, and that could be a problem, even between my son and my daughter um struggles with anxiety and depression, and she would miss school, and my son would be like, well, why is Layla staying home? Because he can't see that it's
Mhm.
not an outward sickness, it's an inward sickness. And he'd be like, well, if she's not going to school, I don't want to go to school. And it's like, having to sit down and explain that to him. And at that time he was 8.
Mhm.
and trying to have that conversation with her is with him saying like, hey, no, this is what your sister is going through, and explaining it. And in terms that he got it, because once he got it, he's just like, oh, okay, that makes sense. And then he was
Mhm.
actually able to sympathize with her and understand her when she would go through those things.
How let me ask you, how you mentioned your daughter and anxiety. Do we do drip treatments for like anxiety on young people too, or what does that look like?
So my daughter, she doesn't like needles. I've been encouraging her to do B12 injections, but she just can't get over the needle, the injection part. But it's acceptable. And if they're comfortable with it, I don't see why not. And at the end of the day, I can say, try it. If it works, it works, and if it doesn't, it doesn't. At the end of the day, medicine, it's called the practice of medicine for that exact reason. It may work for my daughter, it may not work for your niece.
Hmm.
Um, so it is exactly that. And some people feel they'll be like, oh wow, it didn't help with this, but it sure gave me energy, and it helped with other things. So it's all about trying things and being open, and another conversation that we need to have with everybody, children and adults. Like, be open to your treatment and say, hey, this, it's okay to say this didn't work, can we try something else, or this worked for this, so I like this for this, but I'm still dealing with the anxiety, can we look at alternatives for anxiety?
Yeah, no two people are the same, you
Right.
know.
Right. And I get that all the time in mental health. I'm taking this medicine and it's not working. I'm taking this and I'm doing this and it's not working. Can I do other things? And then you present them with alternative measures, and they're like, I don't want to do that either. I don't want to go to the gym and work out 30 minutes or do weight training, which helps with depression. I don't want to do this. I don't want to do the therapy or deep breathing exercise. So sometimes I think we really need to sit down and be like, hey, what do you feel comfortable doing? What is acceptable to treat this? And how bad are your symptoms?
What would be a treatment for longevity?
For,
Longevity, just I mean, it could be just
are we
you
talking
know,
about like depression, anxiety?
like body strength, or just the stuff that, like you were saying, like a B12 or like a multivitamin, just to give you energy so that you don't feel fatigue, like any of those things, the way your
So
skin may
exercise,
look.
right? So it depends on what you want to focus on. So like, definitely vitamins and minerals can help in different ways, and the way you pair them up would be different. So there's different vitamins that help, that focuses on skin, different minerals that will help with muscle, recovery and performance. So there's a lot of different variations of what you would want to work on. That's where the consult would come in, to make a treatment geared, specialized for that individual.
That
Let
makes
me
sense. I was just
And
thinking
as
about my
far as
grandmother.
exercise, like, nobody can go wrong with walking. Nobody can go wrong with, as you get older. As you get older, I would definitely emphasize having lifting weights or incorporating some kind of weightlifting in your regimen.
Hmm. I was just thinking about my grandmother because she'll be 90 this year. So I was like, what are some things that I could do to make sure, that I get to that point and I'm still healthy like she is?
Yeah, definitely. Definitely going to your annual appointment, getting your lab works, knowing your numbers, sleep. To me, that's the biggest thing that you can do, is sleep. Sleep hygiene is number one. That will help with youth and longevity. And they even say people that take naps decrease their rates of having a heart attack
Hmm.
just from a nap
One of our
alone. So,
one of our guest said, one of our watchers said she has ADHD, and she started drinking the rice mushroom coffee and she felt changes in her life. So what do you think about that, about the mushroom coffee? I know it's very popular right now.
yeah, so the main ingredient, if I'm not mistaken, is like lion's mane in the mushroom coffee, and that's geared to cognitive function of the mind, of the brain. And yes, if she's sensitive to it, it's probably going to work. And I feel like there's different things that people are going, their DNA makeup will allow them to feel the benefits of it more than others.
Mm-hmm. Yeah, that's interesting. We also want to say hello to Nikki, Nikaudi Jackson, Ivan Urueña. He's watching us from Colombia. Let's see if anybody else. And LaRoisha Frazier. She said hello and great discussions. Yes, I think this topic here, sometimes we kind of go to the prescription medication, but I love the fact that you're talking about the alternatives. Usually I try the alternative first before I jump to prescription medication. But I just think that, me personally, I just believe that nature has a lot of things that we can cure with
Yes,
nature.
yes,
Um,
I agree.
yeah, and so we kind of, of course there's times that, hey, it might be something drastic that we have to go to some prescription medication. I know when my youngest son, he had pink eye one time, and I was doing a lot of home remedies, but it wasn't working. So I decided, it's time for me to go to the doctor and, get something else. But
Mhm.
that same day I had Googled something else, and they said to put drops of breast milk in his eye. So I put like 2, 3 drops of the breast milk, and it cleared his eye within 15 minutes. So I always do gravitate to natural medicine, but of course, when needed, we
Yes.
might get
And it depends on how long you've been suffering for it. So I feel like, if let's use anxiety for example. If you've been anxious for years, even months on months, while home remedies may help, you may need medication to get that jump start that you need to get that instant relief, and then turn into alternative medications, or homeopathic medications to continue that relief.
Mm-hmm. Yeah,
Yeah.
and I think too, I asked the question about the anxiety, Maddie. I'm glad you asked that, because I think a lot of people have anxiety, but
Mhm.
it's not identified, it's not diagnosed. But I was reading an article about it, and I was like, dang, like I have anxiety, and it shows in different ways. And I think if we can kind of identify those things, it just makes it better for you to be able to relieve some of that stuff, because some of us may go to food or cigarettes or picking our nails, or just kind of your body starts to move different as well. So I think
Mhm.
it's just being able to identify that, what are some things that we can do to find out if we do have anxiety. Like, do we have to go to a professional, or
Well, I think so. For a formal diagnosis, yes, you would have to go to a professional. But again, anxiety is something that you can feel and kind of identify yourself with, feeling worried, maybe a constant feel of doom, unrestlessness, irritability. So these are some of the symptoms that are related to anxiety that you may be able to identify, or you don't need a provider to tell you that. You can say, okay, yes, I feel anxious, and it's all day, all the time, but there may be different levels. You may not feel anxious in every day, but you know what? If you have a job that you have to do public speaking to 3 or 4 times out of the day, you may get anxious around that. Or high performance anxiety. That's a big thing that we don't identify as working professional women, especially minority women that are constantly working and pushing the envelope to meet quotas and do the things, these wonderful, amazing things. But we're anxious. We're living on the edge 24/7, worried about, did this get done? Did that get done? That is a sense of worrying. Or did I forget something all the time? And not being able to relax, or going to sleep, and your mind is constantly going and going and going about 101 things that may be 30 to 90 days from now. So anxiety definitely looks different. And yes, while most of us can identify what anxiety is, you would need, I would say, go get that formal diagnosis, because it will help. And it will also alleviate to say, okay, you know what? This is not just in my mind, and it's not just my job.
Mm-hmm. Yeah, because then we can find different techniques that will work
Yes.
better once we notice that the anxiety is kicking in. I know I'm self-diagnosed ADD. I guess it's fear of going to the doctor to hear it, but no, like I have to catch myself because I'll start doing something and then all of a sudden I get distracted by something else, and
Mm-hmm.
I catch myself like, hey, Viviana, go back to what you were doing.
Right.
And I think that like I'm okay with that. I'm okay with that
Right.
because I'm able to see it and then make the adjustments. But I'm sure there's other resources out there that maybe I haven't tapped into.
So I
So
think sometimes there's a difference too when you bring up ADHD. There's ADHD tendencies, and then there's the ADHD diagnosis. So, and then there's a lot of things that, depending on whether you're a male or female, I think females that go undiagnosed with ADHD have better social skills and better tools that are in place to help them mask or um, deal with their ADHD. So, like for females, we may have no problem using stickies all over the place or creating lists, whereas a male would be, I'm just going to go with the flow, and may find more frustration and irritability would find with their ADHD than women.
hmm. So how often do we need to do the drip?
How often back to the IV? So the IV, I say do it as often as when you feel it's running out. So some people, I have some clients that come and they do it once a month, and then I have clients that come, at bi-weekly. So if you're getting a benefit out of it, it's like, yeah, go for it. Go all the way in. And if
Look,
you're
that
not
might
getting
be my
a
new
benefit,
addiction.
you're not. Huh?
That
Right.
might be my new addiction. And I already see you twice a week, so hit me up while you're here.
Right, right. So again, we need to stop saying addiction is with occurrence. Occurrence and addiction is two different things.
Yeah.
And
Yes,
I
I
think
love it. I love it.
somebody
Yeah,
was saying,
I think it's amazing. I think the work that you do is amazing because I think it's great that balance that you have the ability to give alternatives, but also give prescription, and for you to be
right,
able to identify and give people, because usually when you go to a doctor is like there's just prescription drugs, and they don't
right,
talk about the alternatives. So I love the fact, I think what you're doing is very unique, because you're able to represent both and give people that option of that you can go here or you can go there. I know, like my grandmother, she hates to take prescription medicine, and really the only thing that she takes is blood pressure medication, and she
hmm,
might take something for allergy, or her bones hurt. But I really want to bring her to you because she's about to be 90 and nobody knows her pain but her.
right,
And I think it would bring her, because sometimes too it could be like, I know that you're putting this into my body, but it changes my mindset as well. And
right.
I just like, I'm gonna do a drip party, Maddie, that you're officially invited to. Since you're near, we can't invite Nick there because she's too far away, but I
Uh,
definitely want to do that. And I just think for people to know that this is an option. So even
right,
if you're not here in the area where Noelle is, but to just find something, or you could always get in contact with her and she could possibly direct you to someone, depending on the state that you live in. But I just
right.
think it's amazing that you can offer that, because
Absolutely.
it's something like, how common is, like, what you do, like, do a lot of people do that, or maybe just
So
because
I
I'm new
think,
to it?
right. So I think it is area. So in California, New York, Atlanta, a lot of the city areas are more into it than the more urban areas.
Yeah.
But I think it was Mark that was asking, do you have to do a needle? I do. Part of the drip lounge is doing drinks. Being able to do, I part of it is offering Apigen infused drinks that help with mental clarity, recovery, performance recovery, mood balancing, sleep remedies. So it's all of these homeopathic teas on the menu to help with other things other than getting a needle if that scares you away from trying IV therapy.
Darn it. I told him that he would never be cured because he didn't want to do a needle.
He can still be cured.
Right.
I love everything that you talked about today. We would love to have you on the show again, because even when you were talking about avoidance, I think that's a show in itself.
Oh, yes.
It can show up in so many ways, and it affects young people, older people,
everybody.
Yeah. And just, I think, like Maddie says all the time, right? Like, let's educate ourselves so that we know what to do with it, and to identify, oh my God, like, I'm really doing avoidance, right?
Right.
How do I combat that? And how do I identify so that I can kind of move forward? And I think it makes you a healthier person, to be conscious, to be aware.
Yes. Also comes to mind analysis paralysis. Have you heard of that?
Yeah, we've had those conversations. What else was I going to say? But yeah, so we're definitely going to schedule. I love the drip. I don't know if you could tell, but I love the drip concept. I think it's because it reminds me of Colombia, because I only knew about the drip concept from somebody in Colombia, and I've had it done before. My mom and my grandmother have had it done, but we could only do it when, my cousin came from Colombia to be able to do it, here. So I'm extremely excited that it's coming to me soon. So I love it.
To mainstream.
Right. We might have to stream the experience.
Yeah. So I know you had talked about we can get like a Airbnb and then just make it like a little gathering for and this is more of a female thing, but of course this is open to everybody.
Well, I have things that are geared to men. Men are more interested in mind and mind matters of the mind, as well as performance recovery. So there's definitely something out there for the men.
Perfect. I love it. So we want to thank you for your time. And again, if you guys want to get in contact with Noelle, her information is on the banner here at the bottom. But of course, we'll be running the show throughout the week and other platforms. So this was amazing chatting with you about this. And we definitely, I know in my mind, I have more questions about other stuff.
Right.
So we'll bring that up. And then maybe we could just have like an after show after we have the drip part.
Yes.
So we can talk about the experience. So
yes, absolutely.
Yeah. So as you guys know, I don't know if you know this, Noelle, but I have to tell you before the poem starts, because I say this every show, Latinos, we contribute $3.7 trillion to the economy. So this show, Que Pasa Mujer, we've been doing it for about 2 years, if I'm not mistaken. I think it's going to be 3 years this August or September.
Okay.
And so we feel very proud that we contribute to the $3.7 trillion. And so I make it my business to say that number every time we have the show. And also as I have meetings throughout the community, I mention that number because I think it's about empowerment. And I think that what you're doing is very empowering as well. And so I will make it my business to tell everybody about the drip and the alternatives. Yes. I know you do other stuff, but I just, I'm in love with it. We'll continue to talk about the drip, and we're ready for Maddie's poem, which we end with. You should do a drip poem, Maddie. This is like inspiration.
Right.
I'm going to have to go back to the drawing board.
Yes.
Maybe for the next show.
Maddie comes up with her poems at like 2-3 o'clock in the morning sometimes. So we're going to put it out in the atmosphere, and she will come up with a drip poem. And then when she comes to the drip party, she will recite the poem.
Right at the party.
There we go. Over natural cocktails.
Too much. Okay, so the poem that I'm going to share with you guys, first, thank you, Noelle, so much for being with us today and for all the information. Again, I think this is something different that we have never talked about, and I think it's important to open those conversations and, for us to be able to kind of face and put it out there so that we can prevent things from getting worse, because I think sometimes we look for help when it's a little too late, and then it's like we expect the miracle and we're like, you're not helping, you don't know what you're doing. Well, you should have come to me 2 years. But thank you so much.
Thank you for having me.
this poem that I'm going to share with you guys today, I wrote like 2 hours ago. So I took a workshop earlier today, and in the workshop, the topic was write a survival poem to yourself. So yeah, this is what I came up with. I often felt like I opened my eyes in a time and space that never seemed to fit. Unsteady, fluid surface, I had to learn to swim in it, to exist in it, always trying not to sink. Born in a soil that will always remind me I don't fully belong, that these roots have to learn to survive above ground until I could find a steady place to plant myself, to find other flowers to mix with, to blend in. But this shade of brown is hard to miss and will find ways to stand out in any garden it is thrown in. And that's my gift. I had to learn that I am the daughter of evolution. This body has the power to transform, that these roots can survive in any water, earth, even hell. They have been through the flames and still continue to bloom. I never thought I would see an older version of myself, yet here I am. And to the older me, if you get a chance to read this 30 years from now, just know you didn't need to be a swimmer to survive. Sometimes floating is okay.
Thank you, Maddie. That was good.
Yes, love it.
And it's aligned with the drip.
Yes.
Right? With the life. No, I'm serious. With like taking care of your body, taking care of you. Like, what is it going to look like, right? 30 years from now. So I think it's awesome. Maddie's always on point with the poems. She is like... Maddie also, and I'll send you the information, Noelle, but she has a book called A Book of...
A Vision of She.
Vision of She. It's sold on Amazon. So a lot of her poems are there, and she's working on her second book.
Oh, congratulations.
Thank you.
So again, thank you for your time, because I know it is extremely valuable. I appreciate your time. Thank you, Mark, as well. And I thank Pot TV as well for allowing us to have this platform to be able to talk about everything and anything that we want to with no restrictions. And then also, of course, to our amazing people that were watching us today. So I love it. So we'll see you guys. I hope you have an amazing week. And I hope to see you guys next Sunday at 4:00 Eastern Standard Time.
Whether you're a seasoned designer, dabbler, or just starting out, this course is for you.
You coming?
Are just so impressed with them. Like I said, we've been with them for years. I will recommend and refer anyone to them. We stand by A+ academics. They're the best.
A+ tutorial really did help me with all my grades. They all went up when I came to this place. And I would say I recommend this school to everyone.
So it's a really good environment to be in, especially for me, because it makes me look up to my parents.
If you have students that need academic help, A+ Academics is the place to be. A+ Academics, what a great place to go for academics.
It's just a really great place to learn.